FCT Economic Planning Department has decided to join the Advancing World Technology by incorporating e-health into its healthcare delivery system. This system has been used effectively by the FCT MDGs office in the deployment of mobile healthcare delivery to hard-to-reach areas. The term e-health includes all medical and healthcare services relying on modern ICT. This includes national and regional healthcare information networks and e-record systems like information systems for healthcare professionals and hospitals, online services such as e-prescriptions, databases used for patient care, research and public health, health-related portals, and online health promotion services.
What really motivated us was the amount of data we were collecting from Latvia. You remember with the mobile health, we realized that at the end of every month we were reading in thousands. And then we said it's important to say at the end of 1 year we have about 40,000 from Latvia. We said, guess what? We can get it from all other health sectors. We can get the same information, if we want, from the other primary healthcare facilities. We can get it from the secondary healthcare facilities. And at a time, we can get it from all the healthcare facilities in the FCT, be they private or public. It's important that we know exactly what is the status at the end of each month. It will enable us put some planning perspective into it, because we will know where the diseases majorly are coming from and how we can put public investments to address some health issues. So that means it will give us clue to disease surveillance. And from our experiences, it has really worked well. And it's changing and rechanging our focus into where do we invest public funds in particular elements, particularly in case of malaria or tuberculosis and the rest of it.
The concept of the e-health started as a committee where we said that at this level we need a comprehensive database management in all our healthcare facilities. So we started by saying, okay, how are we going about that? And we said, okay, let's do a pilot for some of the facilities in the FCT to see how the project will spring. So we went on by going to some of the healthcare facilities, which included 8 pilot healthcare facilities: Agana PHC, Gaube PHC, and Garki PHC. Then we have Abaji, Asokoro, and Kuje General Hospitals, and we have Lafiag and Rainbow Clinics, which are private. Because we want it to be a comprehensive thing, we're not just restricting it to government facilities. No, it has to spring across all the facilities in the FCT. So from there, we did a needs assessment. We identified their needs in the hospital, and we took them a step further by giving them training, capacity building in terms of the e-health, of course.
E-health, more or less, we call it the connected health platform. It works in a very unique way, as in it brings the totality of health under one umbrella. That's to have a centralized database system where a patient, for example, biodata is captured and other medical information is saved, and if the patient is referred to a distant clinic, and within the click of the mouse, you get every information about that patient in a far health facility. So you know which doctor gives medication, which pharmacy is responsible for whatever decision. It makes the solution a very beautiful one in terms of simplifying the total health solution in FCT and outside FCT.
Dennis Etuki has been a computer scientist for over 10 years now. He is the technical program manager for Intel Corporation Nigeria. He provides technical advice and support concerning the Intel platform convertible machine used in the e-health program.
My role at Intel is technical program manager, And for the eHealth platform and the project concept, I provide supervisory support to the implementer and also to the governing bodies and stakeholders in different meetings. So I provide all the necessary technical support.
Dennis is here for the eHealth sensitization session tagged Connected Health Platform. The FCT eHealth project is designated to achieve eHealth at all levels of healthcare, starting from a basic to a more complex form of data digitization.
The very first concept, Intel Corporation and FCT were on the drawing board to conceive this solution. And the mobile health had to do the pilots. So from the pilot, we have other stakeholders who came on board. But for the investors, the stakeholders who have put in so much effort in it, I think right now there's a smile on the faces of players and drivers because so many people are getting on the platform. We started with 8 pilot health facilities, and now we are growing to over 30, and in a month's time we have about 60 health facilities signed up on this portal. And outside this, we have other countries, other states who are looking forward to signing up to use this solution. So it's something everybody is smiling over. And for the medical personnel, I think there's the joy of all of them having to sign up to a doctor purchase PC ownership scheme, where every doctor will own technology. So that also is a win for people who have invested, partners who have invested in this project. So there's a win for everybody.
Interestingly, we started a pilot in 8 health facilities, and we did them within the ranks. We had the primary health care in Agana, Abaja, and Gawe, in Kuje, and also the one in Garki 2. And that's what we call Garki village. We also had general hospitals like that of Abaji and Asokoro and Kuje into the fall. We had 2 private clinics, the Lafiat in Abaji and the Rainbow here in Abuja, to do the pilot. The pilot is about 5-6 months now, and we've seen a lot of advantages for doing the pilot. One, it has shown us how many more patients our data can be. We now get our data and render it to all the authorities within time. That is, within the space of a month, we are able to give data about those facilities in the first week of the month. Hitherto, sometimes you look for health statistics you might not even get in 2-3 months because of the numbers.
It saves a lot of time in running the affairs of our hospitals. We can have a comprehensive data bank where all the information we need is accessed. We can access information. If you're looking for information on a certain disease, we want to reach a level where our data is standardized and can be used for even clinical research, can be used for research worldwide. So this information we're gathering now for eHealth is going to be in prevalent circumstances, like something was a legacy left behind. That's what we're looking at. And it's going to save a lot of time for individuals coming to the hospital. Once everything is online, what you have to do is just click a person's name. We have an international code per individual. So once you come to the hospital, we give you a code. That code is supposed to be recognized for now in the FCT. But later on, we don't know where it's going to exhale to. So this code is going to be used for patients to identify all the information relevant to them. And we want to strengthen our linkages between primary, secondary, and tertiary levels of care, and also strengthen the two-way referral system as well.